like to welcome all of you here tonight. I think this is an exciting night. I have the fun job of introducing So our first speaker, I said I could do either the traditional introduction, which would probably take the entire time we're here, or I could do the minimalist introduction on him. He's my mentor in sports medicine, and you can look at his list of accomplishments. But all I can say very simply, he's been around for a long time. He's seen everything. He's followed this whole running revolution right from the beginning. And I don't think there's anybody on the planet, physician on the planet, who's more capable of speaking on this topic than Dr. Jack Taunton.
Thank you, Jim. That's only because I've got gray hair and I've been around the horn a few times. But it's an honor to be invited and with my teammates on the panel. I'd like to thank my research team, many of which are in the 1, 2, 3, 4, fourth row here on my left, in this whole area of working on the minimalistic movement. We started working 4 or 5 years ago, initially with the Nike Free when it first came out. And our first project, when we could see some of the work that our preliminary work and the research that had come out of Cologne, Germany, was the athletes that were in the free, and the whole objective initially for the free was to get back to barefoot running, to see whether a shoe could improve your dynamic strength and your ankle strength. So on the basis of that, that was our first study where we looked at 2 university basketball teams that these athletes had developed acute ankle inversion sprains. This is complete heresy at that stage when we were going to take a very totally unsupportive shoe as compared to the current gold standard, which was an air cast tape and a very, very stable shoe. And what we found out is that with both universities following a standard protocol of initial pressure ice elevation rehabilitation, then one university went with a standard shoe and a brace. The other university went with the free. And we saw an improvement in those who were in the free. There was a significant improvement, particularly in the first 3 weeks, where we did, in fact, could quantify an improvement in dynamic balance and ankle strength. And out of that, there were 2 athletes in that group had been plagued, both a point guard and a shooting guard, both plagued with plantar fasciitis. I was asking one of the athletes, how are you doing? Well, my ankle's still a bit sore, but I'm able to function. I feel much stronger. But the one interesting thing is I've lost that pain in my arch. And it was because of that we then moved on to a very interesting study where we looked at individuals with chronic plantar fasciitis. Group A that had been out of sport because of chronic plantar fasciitis for 2 years, could not run. We had support by WorkSafe BC with this project because these individuals, many of them, were unable to work. So we put this group on a standard, with the same therapist, Scott Fraser out of UBC, exercise program, and we put those individuals in the free. Not in their orthotics, but in the free. And Group B, Group A had been out 2 years, Group B had been out a year. So we were going to really challenge the free. We were giving them the group that had been out 2 years. Group B, they'd been out a year, same exercise program, and they went into a stability shoe, their shoe, and an orthotic. And we identified again, not only an improvement in ankle strength and dynamic balance, but an improvement in strength of their intrinsic musculature of the arch itself. Well, it took Group B 6 months to catch up to Group A in terms of improvement in function, reduction in pain, and a reduction in pain not only for work but during athletics. And we published this last year in the Clinical Journal of Sports Medicine. Our next project, we wanted to know, could we modify the incidence of ankle sprains by putting them in this early minimalistic shoe in adolescent female soccer players? We did see a reduction in severe ankle sprains. This was not significant because we lost a number of athletes because of other injuries, but we did show not only a reduction in ankle sprains, but an improvement in ankle strength and dynamic balance as we had before. Our most recent study that we've just completed was 104 athletes randomly assigned after assessment to a control shoe, the Nike Pegasus, to the Nike Free version 3, and the Vibram 5 Fingers. All athletes trained 12 weeks, ending with the Fall Classic 10K, three sessions per week, including a strength and a track session out at UBC. Online, weekly, they would report on a visual analog scale their pain, their injury, any status and function. We used a slow graduated introduction of the shoes, and a number of them initially reported an ache in tibialis posterior in their plantar fascia. The interesting thing was, after 12 weeks, 99 out of 104 completed the project, and 93 out of 104 successfully completed the 10K run. So you can do it. We're right in the midst of our final analysis of the data, but I think this is the first study with a head-to-head randomized assignment of 2 types of shoes compared to a control. Thank you very much.
I didn't tell the panelists what the consequences are if they go too far overhand. The first thing is a minimalist shoe thrown at you, and then if that doesn't work, then you get the traditional shoe thrown at you. So just keep that in mind. Our next speaker, Adam Janke, is a podorthist. He is the owner and runs Active Orthopedics, and it's what's really interesting is as we talk about this, a podorthist, traditionally started out, I'm sure he'll talk about in his career about making orthotics, and as we're learning, it's so much more complicated now, and a lot of it, what's really important is the proper analysis and assessment of each person that you see. So I will welcome up Adam Janke.
Thanks everyone for coming out tonight. Just let me switch the slides over here. The topic I'm going to cover is something that I think there's a really strong overemphasis in the running media, in particular the running community as a whole, in the idea of strength and foot strength. And the average training community or the average trainer and the average runner that comes in to see me at the office often comes in and says, what do I need to do to strengthen my feet to go minimalist and go barefoot? And my opinion, my contention is that with a lot of runners, it's actually a mobility problem that we face first and then a strength problem second. So strength is important. Yes, there's lots of people out there that have weakened feet and selectively weakened feet. And I think Dr. Taunton hit the nail on the head about dynamic strength being an important part of it. But a lot of people also present with a mobility problem. So I've got a couple of headlines up here I just pulled offline and some newspaper sites. You read through them, this is kind of standard stuff that you see out in the industry and out for the public. And you read that first when you wonder how any of us are actually going to stand up and walk out of here tonight. But it's pretty standard stuff, but this is such a changing topic. 6 months ago we knew one thing, now we know another thing, and there's even more research coming. So I'm not going to go through all these papers, but what we do know is that running with a forefoot style, which tends to come along with barefoot running, reduces peak loads at the knee and the hip, reduces torque at the knee and the hip, reduces initial collision or impact between the foot and the ground when we make contact with the ground. And a really recent study from Dr. Liebman, who's quoted in Born to Run quite extensively, shows that rear foot strikers who habitually rear foot strike are twice as likely to sustain a overuse injury than people who forefoot strike. But those forefoot strikers were habitual forefoot strikers. We also know that the foot is clearly part of the equation here. I mean, we're making changes at the foot. We're taking shoes away. We're putting less shoe on. And we're seeing these theoretically positive outcomes above the foot and in the foot for that matter as well. But what we don't really know conclusively yet is why. There's no real cause and effect yet as to why we're seeing all these positive things happen in the foot and, of course, above the foot. And the default answer, if you read the media and, again, even read the marketing, is that we've turned our foot into the anatomical equivalent of this guy. So if you look into some of the articles that are out there and some of the research that's out there, you'll see that there's a sort of a second side to the coin, or another side to the coin, if you will. This is a quote from one of Nike's head guys that was involved, or one of their head researchers involved in the Nike Free. And it sort of exemplifies what I think is a really, really important aspect of the feet, and that's mobility. And if we're taking a shoe away, there must be some sort of change at the level of the feet. So another consistent finding you'll see in some of the research papers out there, although it's not been studied extensively, is runners who tend to forefoot run or forefoot strike will generate significantly higher joint moments or range of motion, or utilize more range of motion at the ankle, in particular in the sagittal plane. So that's your dorsiflexion. That's your foot bending back towards your shin. And this is really integral because it kind of speaks to the idea of the laws of conservation of energy, and that nothing disappears. A shoe doesn't make forces disappear. A bare foot doesn't make forces disappear. It just has to shift around somewhere. And if we're taking away from the foot and opening up mobility in the foot, we're allowing the foot and the ankle and the lower leg complex to do its job. And that is theoretically right now believed to be things like elastic recoil, of course dynamic strength and function, but it's a really, really, really integral piece of the equation. In my own office in the last 2 years since I started to follow more of the minimalist stuff, I find a huge number, overwhelming majority of runners present and recreational athletes present with a lack of range of motion in that ankle complex. And they're actually usually fairly darn strong in their feet, and often very, very strong in their calf muscles as well, but they have really bad range of motion. So training around or strengthening that foot, that ankle, inside that range of motion is just going to end up making a lot of people tighter. So we need to really think critically, and I know clinically we know that dorsiflexion is incredibly important, but for the average Joe public, we really need to focus on the mobility side of the equation as well. So why are people presenting with this lack of range of motion? Well, we all know, for the most part, the idea of ramp angles in running shoes. Obviously, women can speak to. Women, do your legs and feet feel weak after wearing heels? No, I would say no. Men's dress shoes. I mean, the big part here, guys, is not just about your running footwear, and I know this is about running, but a lot of this as well is going to be about your day-to-day choices, your lifestyle choices. We run maybe a few hours a week if we're lucky. If you're really active, maybe a little bit more. What about the rest of your week? What are you in? It's a big, big part of the equation, and if you're in a shoe that's going to tilt you forward and create this tension in the posterior chain in particular, we're going to struggle. We're going to see problems progressing to this barefoot or minimalist style of running. So if you want to go bare, strength is absolutely important. I'm not sitting here saying strength is not important, but I believe functional and dynamic strength is the key. It's about strength through a full range of motion. Use your foot the way nature has intended it to be used. Also, absolutely positively work on your foot and ankle mobility, be that stretching, be that rolling, getting treatment done, whatever it might be that you individually need, get that work done, because that mobility is absolutely, absolutely key. Wear the most minimal shoe you can handle. There's a lot of debate about what's right and what's wrong in terms of a minimalist shoe, but talk to people who know, talk to the shoe retailers, talk to a clinician, talk to friends, talk to runners, talk to coaches, trainers, talk to people who know the topic. And last, but certainly not least, is get out and walk barefoot or in a pair of Vibrams. You know, it's Vancouver, it's cold these days. Get that foot activated, get it turned on, get it onto a natural surface, and get it moving and doing the things that it's supposed to do. So I'm going to leave you with a few quotes here. The first two are from a physio that I think has a really good grasp of movement as a whole, and he's a real big proponent of mobility first, stability or strength second, and building strength around an improper movement pattern or a poor movement pattern is just silly. So we can't just focus on the strength aspect of people's feet. And if you don't know who the last guy is, you probably shouldn't really be in the room, frankly. So thank you very much for coming out tonight, guys. We really appreciate the support.